Good day, everyone. So, my topic was all about attack and escape behaviors. So, Arya's report was all about attack behaviors and fear and anxiety. So, my topic was all about the anxiety and disorders, relief from anxiety. So, from the relief from anxiety, what we called pharmacological relief and alcohol anxiety. So let's move on to my report, which is the anxiety disorder. So what is anxiety disorder? So anxiety disorders is a are type of mental health condition because anxiety makes it difficult to get through your day. And what are the symptoms of anxiety disorders? So, first is feeling of nervousness, second is panic, and third is fear, as well as sweating and a rapid heartbeat. So, in anxiety disorder, we have this called panic disorder. So, what is panic disorder? So, panic disorder is characterized by frequent methods or periods of anxiety and occasional attacks of rapid breathing, increased heart rate, sweating, and trembling. In other words, extreme arousal and sympathetic nervous system. So, if we talk about panic disorder, so panic disorder has also causes, or should I say that what causes some people to be prone to anxiety. So first is difficult experiences in childhood, adolescence, or adulthood, and second is going through stress and trauma. So before I proceed to the PTSD, which we call traumatic stress disorder. So let me further discuss to you about the anxiety, or what is the anxiety. So anxiety disorders. So what is the anxiety disorder? So what is the right amount of anxiety? So it depends. Your life circumstances might justify great anxiety or much less. In the book, so the researchers said that they have this model. So it is they experiment rats become their model in anxiety disorder. So in their experiment, they have this tone one and tone the tones of the rats. So first tone is they predict the weak shock, and second is they predict the strong shock. And since amygdala responses to two tones, so after a tone predicted a wild or a weak shock, amygdala cells responded only to that tone. And if the amygdala predicts strong shock, so many amygdala cells responded um, unselectively to all tones. And so let's proceed to the PTSD, which is the post-traumatic disorder. So post-traumatic disorder is a disorder that develops in some people who have experienced a shocking, scary, or dangerous event. So basically, post-traumatic disorders are people who's actually from experiencing traumas, or like watching the like any movies, then kanang they shown it live through live experience, for example killing. So it can trigger the post traumatic stress disorder in a person. So next is the relief from anxiety. So from the relief anxiety, the pharmacological relief, they have this most uncommon anxiolytic, or what we call anti-anxiety drugs, which is the benzodiazepines. So these benzo Tama. So these benzodiazepines is um is a trade name of Valium and chlorodiazepoxide or Librium and alprazolam, which is the Xanax. So this drug bind to the GABA A receptors, which includes a site that binds GABA as well as the sites that modify the sensitivity of the GABA site. So if so we have this pictured. So as you can see in the picture, we have the GABA receptors, cross section, and also the benzodiazepines facilitate GABA binding. So GABA binding, um, so in this picture, um, it explains on which includes a site that binds GABA. So the brain also has other kinds of GABA receptors such as GABA B with different behavioral effects at the center of the GABA A. So receptor is a chloride channel. So when open, it permits chloride ions to cross the membrane into the neuron, hyperpolarizing the cell, or at least so as you can see. So from the GABA receptor, so we have this what we called neuron membrane. So neuron membrane so the neuron membrane are the like responsible for the passing the what we call the message to the cross section. So after the cross section, um the membrane also, like what I said, it is the one to facilitate the to cross information until it goes through the benzodiazepines. So in the benzodiazepines, so we have this first is they have two A and B. So in the first A, the which is the receptors for benzodiazepines, and in the outer for the B, it is the GABA receptor. And we have this blue section, or we have this blue blocks. It is described the GABA molecule, and in the A we have this kind of green or orange blocks. It describes the benzodiazepine molecule. Okay, so we have this question about this drug. So what would be the effect of the benzodiazepine on someone who had no GABA? So the answer is the benzodiazepine facilitate the effects of GABA. So a person without GABA would not respond to benzodiazepine. So let's proceed to the next, which is the alcohol and anxiety. So many people experiencing stress or any anxiety, they usually drink alcohol so that they can um, I like it's not erasing the stress that they have, but slowing the progress that they have. So in alcohol and anxiety, they usually drink alcohol because it reduces anxiety through the effects on GABA receptors. So as what you can see in the picture, so we have these two rats. So the researchers or the experimenters explained or test these two rats. So the first rat drink the researcher let the rat drink the alcohol first and test on what will be the effect if the rat drink the alcohol. So as you can see in the first picture, the rat usually dies when he drinks the alcohol. And if we see in the left side, the rat is already taking the alcohol, but the rat didn't die. um, it is because that the researchers, like, I think they inject something or have this drug called RO15 4513. So it is particularly effective in blocking the effects of alcohol on GABA receptors. So they they said that this drug blocked the effects of alcohol on motor coordination, um, its depressant action on the brain, and its ability to reduce anxiety. So in addition, this drug RO154513 be useful as sobering up. So it's not like a drug, but it's a pill or as a treatment to help people who want to stop drinking alcohol. So the researchers, um, like, they took the risk to have this kind of pill to share with other people, because people who relied on the pill may think they were sober enough to drive from home when they were not. So it also giving such appeal to people with alcoholism would probably backfire, because people with alcoholism drink to get drunk, and a pill that decrease their feeling of intoxication will probably lead them to drink even more. So that's all for my report.